Hi, thank you so much for the opportunity to speak at today's conference. My name is Alison Barkoff, and I joined the Administration for Community Living as the Principal Deputy Administrator, and I'm currently acting as the Administrator and Assistant Secretary for Aging. Let me start with a visual description. I'm a middle-aged white woman with curly brown shoulder-length hair and wearing a blue blouse and a silver necklace with a logo behind me that is from HHS and the Administration for Community Living. And it's really such a privilege to join an agency that is focused on what has been my own life's mission, which is supporting all people, regardless of age or disability, to live and fully participate in their communities. And self-direction is central to ACL's mission and vision. And of course, it is central to self-determination. Throughout studies, we have learned that self-direction not only empowers people, but it also can be more efficient than agency-directed services. Before I jump into priorities of the Administration for Community Living and HHS, I really want to start by acknowledging the incredibly devastating impact that COVID has had on people with disabilities and older adults. Our communities have faced the highest risks of infections and deaths, particularly people in institutional and congregate settings. We face discrimination in accessing life-saving treatment, loss of services, and social isolation. And I really want to thank all of you and organizations like Applied Self-Direction that have been tireless in working to make sure that people can get the supports and services that they need. It's truly been not only important, but literally life-saving work over the last 2 years. A top priority for the administration and ACL since I joined on the first day of this administration has been to be a partner in the fight for disability rights throughout the COVID pandemic. And that's truly been one of my priorities from day one. We know that people with disabilities and older adults have faced barriers in accessing life-saving treatments and life-saving measures like vaccines and PPE. And that's why we were so thrilled early on last year in March of 2021 to start the first ever partnership between ACL's networks and the Centers for Disease Control with $100 million in funding to help assist with vaccine access. We also used some of that funding to start a first ever national hotline to help connect people with disabilities to resources. Everything from assisting in accessing vaccines or tests or masks to connecting people with community services, housing, or nutrition supports. Through that disability information and access line or dial, we've already assisted more than 35,000 people with disabilities and more than 50,000 older adults since we launched in August. We also know that the pandemic has created some new opportunities to build relationships between ACL's aging and disability networks and the public health systems that for too long have not had competencies in knowing how to address the unique needs of older adults and people with disabilities. I was thrilled to announce earlier this year $150 million in public health workforce funding to allow ACL's aging and disability networks to hire staff to work on critical public health issues that impact older adults and people with disabilities, everything from the important work of diverting and transitioning people from high-risk institutions back to the community to really affirmative planning to make sure that the needs of people with disabilities and older adults are considered in the next emergency. And now we're working on trying to get N95 masks and in-home tests out, particularly to people who face barriers in leaving their homes. Last month, ACL announced a partnership with the Health Resources and Services Administration, or HRSA, for our disability and aging networks to be able to get masks and tests to distribute from community health centers and rural health clinics. And finally, on COVID, I want to mention that we know a huge priority for the disability community is long COVID. It truly is the largest mass disabling event in decades. And we know we need to make sure that not only can people access treatments for long COVID, but that more people are going to need the community-based supports that we all are working towards expanding. Our second priority at ACL has been expanding access to home and community-based services. And it's not only a top priority for us, it's been a top priority for the Biden-Harris administration. COVID-19 laid bare the risks of congregate settings, with more than 1/3 of deaths to date in nursing homes and other settings. And we know that in order to make sure that we can help transition people from long-term care facilities back to the community, we need to have the services and supports there. I'm really excited to share that just this week, the Centers for Medicare and Medicaid Services issued a new notice of funding availability for Money Follows the Person, expanding the hugely impactful and successful program that's helped more than 100,000 older adults and people with disabilities transition to the community. For the first time in years, it's open to new states. And in addition, they put out a new policy that will allow states to use grant funding to address some of the biggest barriers in transition, including things like being able to use grant funding to pay for short-term housing assistance and nutrition supports. We know we face huge challenges in the community, and we can't serve more people if we don't tackle the direct care workforce crisis. That was a crisis before COVID, but that has truly turned into an emergency. Many providers are now declining referrals, shutting down services or programs, or even moving from more inclusive and individualized services to more congregate models. We have an urgency to expand home and community-based services. And that's why the administration was so pleased when Congress passed the American Rescue Plan with $12.7 billion increase for home and community-based services. And states have used this funding to expand critical services, serving people on wait lists, supporting the direct care workforce and family caregivers, and working to transition people from institutions to the community. Many states throughout the pandemic and with this funding have also been expanding opportunities to self-direct services. We know that this funding is just a down payment, and the president has made that clear. Thank you to everyone at this conference for your important work to educate policymakers about the ongoing and crucial need. We know that the demand for services is well beyond what we have, and we know that self-direction is one of the strategies that we're going to really need to lean in on to expand beyond the traditional workforce. The need for direct support professionals remains, and expanding self-directed care helps alleviate some of the really serious direct workforce crisis issues because of the flexibilities that self-direction allows in who provides support and how to structure that. ACL is absolutely committed to working across our partners at Health and Human Services and across the federal government, including with the Department of Labor, on how we can use every tool in our toolbox in the federal government to support the direct care workforce. In the coming months, we'll be sharing more about a direct care workforce initiative that will be leading out from ACL, but of course we'll be working across the government. The last thing I want to mention in the bucket of expanding and strengthening home and community-based services is the fact that we are now in the last year of implementation of the really critical home and community-based services setting rule, a rule that provides people who receive community services a basic right to self-determination. Things like accessing food and having visitors, being able to lock your door, and going out into the community, making sure that the benefits of community living are available to everyone receiving home and community-based services. At ACL, we are working hard to make sure that the voices of people who are most impacted, people receiving services, are heard in state implementation, and we are continuing to play an important role collaborating with CMS and supporting stakeholders in implementation in their own states. Let me talk a little more about some of our work specific to self-direction. ACL is absolutely committed to the principles of self-direction and funds self-direction programs because self-direction offers more choice and more control over who provides services, as well as when and how the services are provided. Self-direction not only means services that are tailored to individual preferences and goals, it also means the person receiving services has power, the right to hire and fire, the right to alter and adjust the service, the right to decide which problem needs to be addressed first. ACL administers the Older Americans Act, which provides states a self-directed care option. And right now, more than 13,000 people in 8 states are self-directing Older Americans Act services. We also collaborate with the Centers for Medicare and Medicaid Services and the Department of Veterans Affairs on other self-directed efforts. We provide CMS consultative and supportive assistance to assure that the work to meet the goals of the 2014 guidance for implementing standards for person-centered planning and self-direction in the home and community-based services program under the Affordable Care Act are translated into reality. And we're continuing our work to support the Veterans Affairs on expanding their Veterans-Directed Care Program, which ACL helped develop. We provide technical assistance to 152 aging and disability network organizations that are veteran-directed care providers. And we're working with 70 VA medical centers in 37 states, the District of Columbia, and Puerto Rico. Combined, they serve more than 3,800 veterans, and that number is growing. These veterans are at risk of nursing home admissions, but because of the program and being able to direct their own care, they're able to successfully stay in the community. CMS and ACL also work together to fund the National Center on Advancing Person-Centered Practices and Systems, or NCAPS. And we're in the process of launching through NCAPS a self-direction learning collaborative to bring together teams of people with professional and lived experience from states, territories, and tribal human services agencies, along with other stakeholders, to engage in peer-to-peer learning as they pursue a common aim to expand and improve self-direction. Next, I want to talk about a priority at ACL that's so critical. It's not just about living in the community, it's about quality community living. And we know that means we need to make sure people are getting services and supports that keep them healthy, safe, and address their welfare. On the policy front, ACL continues to work with CMS on quality measures and ensuring health and safety for HCBS participants. Inside of ACL, we're continuing our work on Living Well grants that test model approaches to community monitoring strategies. Another important strategy to keep people safe and free from abuse and neglect is ensuring that people are self-determined and know how to advocate for themselves. That's why we continue to invest in self-advocacy. We just funded another 5 years of the Self-Advocacy and Technical Assistance Resource Center, or SARTAC, and just last year awarded a 5-year grant to the Center for Youth Voice, Youth Choice to address the school to guardianship pipeline that can impede self-determination. We also have a number of other forthcoming initiatives related to bridging the aging and disability networks as we support adults with intellectual and developmental disabilities as they age, and also with a lot of intentionality, particularly as we as a country are focusing on expanding behavioral health supports. We need to make sure, and ACL is working on an initiative focused on people who are dually diagnosed with intellectual and developmental disabilities and behavioral health needs. Finally, I want to end by touching on equity. From day one, the administration has directed that all federal agencies center equity in everything that we do. In ACL, that means that we bring an intersectional lens to our work. The executive order from the president not only talks about racial justice and centering that, but looking at and specifically calling out the needs of people with disabilities as an underserved community. So with our intersectional lens, we're looking at what are the barriers that people with disabilities face who are also from communities of color or are LGBTQ or don't speak English as a first language or live in rural areas. And we need to make sure that the benefits of self-directed care are available to all people in all communities. In ACL, that also means that our work to advance equity must include working across HHS and the federal government on ensuring that our work around health equity and addressing disparities includes an intersectional lens that focuses on people with disabilities and older adults. And we're bringing that work into everything from ensuring data collection, looks at those intersections of people with disabilities who may also be in other underserved communities, or ensuring diversity in research and drug trials includes people with disabilities. I want to end by saying that ACL is always focused on the question of how do we best support people to live the life they want in their communities. Self-directed programs offer individuals more choice and more control over who provides those services, when and how, and it really means services tailored to the lives that people want to lead. ACL is committed to continuing our work with CMS and with the Department of Veteran Affairs and to make sure that we are really bringing these important programs to scale. We applaud the work that all of you do to make sure that funding is available for self-directed programs and all of your efforts on the ground in your own states. Our job at ACL is to support all of you so you can continue to contribute and advocate in your own communities. Thank you for all of your incredible and hard work, and thank you again for having me.
Thank you, Alison. I'm James Toews, a senior consultant with Applied Self-Direction. Just a couple follow-up questions to your remarks. The national aging and disability community represents a huge array of different and separate organizations that often do not act in concert. Is there any role that ACL can play to start sort of gluing all these organizations together, given the huge challenges that we have in the long-term care arena?
You know, ACL really plays an important role in having both disability and aging in one organization requires us to really find what are the areas of commonality, and at the same time recognizing the differences in disability and aging. It's been incredible both in the challenges in COVID to see the commonalities and the ways the aging and disability communities have come together to really address some of those key issues that people have faced, and to see the incredible advocacy, as I mentioned, the momentum, the wind behind our back as the spotlight was shown on really how fragile our long-term care system is and why home and community-based services are so important. Seeing those coalitions that have been built to really advocate for more resources and an expansion of HCBS has shown me what we in ACL really can do to support that. Also say that on issues of health and safety, it's another place where we've really thought in ACL, how can we leverage our networks? Everything from our protection and advocacy agencies to our long-term care ombudsman. So I think in ACL, we really play this policy goal of bringing together advocacy organizations from the aging and disability community to find those common grounds, and also bringing together our disability and aging networks to find and support how they can do work together in their own states to move forward shared goals.
Great, and almost a similar question. You've spent a lot of years in advocacy before you joined the federal bureaucracy. And for all the attendees at this conference, we're going to have a pretty large crowd. Any advice you have to all of our conferees on how to advance advocacy for self-direction in particular and long-term care in general?
Yeah, you know, having done so much advocacy, we can put together all this data and all this information, but at the end of the day, what makes a difference is people's stories and the difference that it makes in people's lives. And so I really hope at the conference, everyone who's there, as you're thinking about advocacy, whether it's advocacy that you do on a federal level with policymakers or in your own states, we have to be able to show what difference does this make? And telling your own story. It's important that, you know, people who are professionals in the field need to bring actual people who receive services with them, actual people who self-direct, you know, people who provide those services, the direct support professionals, to talk about what does it mean? How have these services changed people's lives? It's really important. And the second thing that I would say is sometimes when I'm working with folks, they feel like, I don't know where to start in advocacy. I'm not an expert. I don't know all the policy weeds. I'm not wonky. If you know your own circumstances, you are an expert. And it's really critical that your voice is involved, whether you are involved in your own local community or in state policies, or whether you work with Applied Self-Direction and other coalitions around federal policy. Advocacy is so important. And I think we have a truly once in a lifetime moment right now. The issues that so many of us have been working on together literally for decades. And we're trying to explain to people, what are community services? What does this mean? Why is it important? Right now, we open up a newspaper, we open up a magazine, and everyone is talking about our issues. Just yesterday in the Washington Post, on the second page was a story about why are people not going back to work? People aren't going back to work because so many people have had to take on caregiving and had to take care of family members with disabilities or older adults and their families. And why are family members doing it? Right there on the second page of the Washington Post, talking about the direct care workforce crisis. So I think we have this real opportunity right now to move the ball, to really address what we often call the institutional bias that exists in our long-term care system in a way that we have never had before. And so I hope people really hear this as a call to action, because I feel so passionately that together, if we bring together the disability community and the aging community and the workforce that's so critical to providing this and labor rights, that we can, for the first time, really move the ball forward in such a critical way.
Great. Thank you so much. And we're very pleased that you were able to join us. And hopefully we can all talk to you again soon.
For
Take care.
having me.